In this video clip, I want to talk about the difference between infection and an immune-mediated chronic inflammatory condition that's related to a microorganism. There's a big difference, but it's a subtle one, and it's hard for a lot of people to grasp. And it'll lead into a discussion of Lyme disease, which has created a lot of controversy through the treatment of LDI, or with LDI rather. Infection means that a microorganism has gotten into a place in your body where it does not belong, and your body is violently reacting against it to get it out of there because it is potentially dangerous to you. So, like endocarditis, which means you have an infection of bacteria on one of your heart valves in your heart, that's a good example of a severe infection. One of the most severe infections you can get. You usually only see it in intravenous drug users or somebody else who's injecting dirty stuff directly into their bloodstream. But if you get an infection of bacterial growth on your heart valve, that's really bad. You might die. But you can clear that up with 6 weeks of intravenous antibiotics in most cases. Sometimes they have to replace your valve surgically too, but that's a whole other issue. More common examples include urinary tract infection. If you get a bladder infection and it burns when you pee and you have to pee every 5 minutes, that's an infection. That's a germ that got into your bladder where it isn't supposed to live, and you can get rid of it in 3 to 5 days of antibiotics in most cases, and then the germ's not there anymore and your symptoms are gone. That's typical infection. If you have what feels like a bladder infection all the time, and you do urine cultures and nothing keeps growing over and over, and antibiotics don't give you resolution, then you probably have something more like interstitial cystitis, which is a chronic inflammatory process within the bladder and urinary tract, and it's not an infection at all, but it feels just like one. If you have acne, I mentioned this previously, acne is thought to be an infectious process, and it is treated as such by dermatologists. They'll put antibiotics on the skin, and people will get better, their skin will look better, but as soon as they stop the antibiotic, it comes right back. Why? They'll put them on oral antibiotics, and they may clear up while they're on it, and then they're taking minocycline for 5 years through adolescence. And then if they stop any time along the way, their acne comes back. Why? Because acne is an inflammatory response against Propionibacterium acnes. This is a microorganism, a bacterium that lives on everybody's skin. So why doesn't everyone have acne? What defines the difference between those with and without acne is not whether they have the bacteria or not. It's whether their immune system reacts to that bacteria. And if you do have an abnormal, unnecessary immune attack on this organism, you get pustules around different places of your skin where this organism tends to live. This organism lives on your face, your upper chest, and your upper back. So those are the places you get acne. It doesn't live on your hands and feet, so you don't get acne on your hands and feet. But if we reestablish immune tolerance for the patient using a diluted version of dead Propionibacterium, they stop having acne. So acne is not an infection at all. And I've observed the same thing by treating people with staph infections people get recurring boils and whatnot. Those really look like infection, but when that is the scenario, we desensitize people or promote tolerance to staph bacteria with this skin bacteria mixture I put together. They quit getting boils. It also works for herpes outbreaks, like genital herpes and cold sores. Therefore, those things that we always viewed as a viral reactivation and a failure of immune defense are not. They're actually an abnormally aggressive immune attack in those cases for some people. Lyme disease also fits in this category. Lyme disease, people have tried to treat with antibiotics for decades now, and even giving the typical Lyme patient antibiotics for months or even years, you don't cure them. You don't eradicate this problem. Some people will experience improvement while they're on antibiotic therapy, and then when they stop, their symptoms resume. So I think what is happening in that scenario is they're suppressing the antigenic trigger to a level below the threshold of immune reactivity while they're on antibiotics. But then you take it away and the level rises back up because these organisms are in everyone. They are actually part of the human ecosystem. They are measurable in mummified human remains that are thousands of years old. They've been around since before there were people. And to think that you have to get them out of the body to be well is just flat wrong. So what we found is that through the use of LDI to reestablish tolerance to those organisms, you can restore harmony in your organism and in your ecosystem. They just live in you, and they don't harm you. and your immune system stops attacking them, so your immune system stops harming you as well at the same time. Because all the symptoms of Lyme disease or other chronic inflammatory syndromes that are labeled variously, like MS or whatever, that are really triggered by the Borrelia organism or Bartonella or Babesia or whatever in this Lyme and co-infection complex, they like to call it, they're all immune mediated. All those symptoms are actually a function of your immune system. So if we reestablish tolerance for the organisms, the symptoms go away, and the bacteria keep living in you just like they live in me and everybody else. And that's called normal human existence. So the idea that you should treat that as an infection has always been incorrect. And that was a theory I had until I started using LDI for this, and then that gives us a way to prove the theory very definitively. So we don't treat anyone using antimicrobial therapies for these conditions now. We just reestablish immune tolerance, and you can make people continuously well. Why this is happening to people is a whole other question, which I should use another video clip for, because these shouldn't be too long.